made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes and to continue hustling. This episode is sponsored by Transact Card, Align Life, Neuro Infinity, Imaging Services, Chiro Health USA, Chiro Moguls, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, New Patients in a Box, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. Let's hustle.
Hey guys, welcome to episode 514 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Beth Clay of the ICA. And if you want to hear a story about how the future of healthcare is in the hands of chiropractic, stay tuned. Welcome back. This is another episode of the Chiro Hustle podcast. Today I have Beth Clay on, president of the ICA, International Chiropractic Association. She has a big event coming up this weekend out in beautiful Las Vegas, Nevada. It's the annual gathering of the ICA. So we're going to talk about that a little bit. But before we get into this episode with Beth Clay, I'm just going to let everybody know the big why. Why do we do what we do over here at Chiro Hustle? Well, first and foremost, we believe in the First Amendment. A lot of people kind of gloss over that, Beth, and they don't really understand what that is, but it's freedom of speech. And the reason that our show exists is because we've been protecting freedom of speech for chiropractic for 5.5 years with this show. And I think that that's integrity, and we need to do that. Second thing, and I know we're going to take some dives on this one today. We're going to go down the path of medical freedom and family health freedom, which I think are essential to a free state and a free nation. And I think that those things sometimes get glossed over too, because the people that I bring on are chiropractors and they might not be so well established to discuss those topics. But I think today we're going to be able to talk a lot about medical freedom and what it means to our nation. And I know we have a presidential candidate in the run now that we are very, very proud of. So we can talk about that a little bit too. But second part of my intro is we do protect BJ Palmer Sacred Trust. If many of you know what that means, if you don't know, go to your favorite search engine right now and look for BJ Palmer's last words. And here's the really cool piece of history. BJ Palmer started the ICA. So he started the International Chiropractic Association group that Beth is the president of. So I think it's really cool that we stand for a lot of the things that you guys support. And I think there's a lot of synergy here with this show. And we also support subluxation-based chiropractic. I know that that's talking to chiropractic circles. That doesn't mean so much to them, but to the public, when somebody doesn't know anything about chiropractic and they start listening to our show, they start to go and Google all this stuff. They start to go and look on their favorite search engines as to what are these things that James Chester's talking about on the Chiro Hustle podcast. And then a couple things that really matter to us too is when someone gets adjusted, man or woman, the physical, we believe in innate intelligence and universal intelligence. And we believe that when a man or woman gets adjusted, it connects them to an innate source, which connects them to universal source. And I think that those are things that are really important for people to understand about chiropractic too. So without any further, this is episode 514 of the Chiro Hustle podcast. And I just want to welcome Beth Clay. Welcome.
Well, thank you, James. I am certainly happy to be here. And I just want to correct my title is I'm not the president of the ICA. I'm the executive director. Dr. Selena Sigafus Jackson is the president of the ICA. So I just wanted to make that correction as we got started so that wasn't lost in the wayside. And I am excited that she will be interviewed by you in a few days during our annual convention here in Las Vegas. We've just landed, the home office team has just landed here in Las Vegas and getting things set up. And we have a great lineup of speakers for our continuing education program, and our board and our representative assembly will be here meeting, developing strategies for the future of the ICA and for the profession. And I'm so excited to be here on this podcast with you. You know, you're talking about my life passion, which is freedom. I have certain goals in my life, and that's to promote health freedom, to seek truth and justice. And the importance of chiropractic in my life has been a part of my life since I was about 3 years old. And I'm just very excited to be the executive director of the ICA for the last 3.5 years, and to be here in Las Vegas for us to be together in person for an event for the first time in a year since we were at the Sherman campus last April. So.
Yeah, there's a lot of momentum, and I think health freedom is something that I'm really curious to talk about more. But let's go back into your chiropractic story a little bit. How did you get involved with chiropractic? And you said since 3 years old.
Certainly. Well, both of my parents, my father was an attorney, my mother, typical housewife with a passel of kids, and they both had serious back issues. My father had injured his back jumping out of airplanes to earn extra money. He was in the reserves after being in the Army in Korea, and so he'd jump out of airplanes and had a few rough landings. And my mother had issues, and so she was driving in a town next door to our small town in South Carolina, and there was a chiropractor's office there, and she felt called to stop in. And you will love this story. She met with him, and he said, Now, Miss Clay, you go home and you talk to your husband about this, and you bring him in, and if he's willing to let me treat you, I will. And then, of course, my father came back. They both became patients. The whole family became patients, and we became very close friends with this particular family. And as it turns out, I would learn, about 5 or 6 years ago, that my first chiropractor was a state representative for the Representative Assembly of the ICA. And so I got my first lessons about what creates health and how to be healthy from an ICA chiropractor. And Doc Bolin was amazing and just a tremendous individual, and many members, several of his children and other members of his family continued in the profession. And that's something that's, for me, it speaks volumes of the chiropractic profession, that so many families are multi-generational. We have doctors in our leadership that have 35 members, 35 chiropractors in their family, or 13 chiropractors in their family, and are second or third generation chiropractors. And that says something about, if this wasn't such a powerful profession and a healing art, this entire system of chiropractic, then people wouldn't continue to have this as a family profession.
Yeah, I think there's so much to be said about that. And I've met also a long lineage of people, even if it's like 2 people and they pass it down to the next generation. I think that that's really cool that there's a lot of chiropractic support from seeing it as a viable profession that can be passed down. And I think it's really cool. I just interviewed a gal last week that she was second generation chiropractor, and she was talking about how she really enjoys it. She enjoys working in the associate model with family.
I think that's tremendous, and I chuckle. The ICA has some mentoring activities that we work with in some urban environments in the Washington D.C. area, and I always chuckle, and I'm like, this is an opportunity for individuals, for youth to look at having a doctor in front of their name, to work hard and earn being called doctor, but not becoming a drug dealer. Because basically, the medical profession today, they're just legal drug dealers. And that's sad, because, the word doctor, is equivalent to being a teacher. And for chiropractors, as the doctor of chiropractic, you're teaching people about health and what the role of the innate is in helping the body to heal, and the role of the adjustment in doing that. And I've personally had so many experiences in my life where, migraine headaches, recovery from being thrown from a horse, issues where the first stop was the chiropractor. Because if I didn't get an adjustment, then I was just wasting my time, because I wasn't letting my body, be set up to be able to heal itself.
Yeah. Once again, I think that there's a lot that goes into this profession of chiropractic.
Mm-hmm.
And understanding that there's such a depth of education that needs to be had. And you are right, chiropractors, it's a healing art, and that's something I fell in love with about the profession too. It adds nothing extra into people's bodies. It simply removes interference. It allows body to have its full life expression, which is vitalism. And I think that that's something that the wellness model of the pharmacy world and the CVSs and the Walgreens of the world, they capitalized on this so early, and they started talking about that being wellness. But I think now we have a confused consumer out there that doesn't know really what wellness is, or it's never been talked about what vitalism is really mainstream. People don't know the first thing about vitalistic lifestyle.
Well, what's interesting is I didn't become a chiropractor. I didn't, that was not my life path. My life path ended up being in the policy world. I 30 years ago, I ended up working at the U.S. National Institutes of Health. I spent 7 years there working with some amazing scientists and working in the original Office of Alternative Medicine with experts such as Wayne Jonas. And I got to be at the right hand of all of the developments of the Office of Alternative Medicine, which is now the National Center for Complementary and Integrative Healthcare. And so there's a whole lot that's happened in the background that I have been firsthand a part of, and some of it played a role in developing certain things like the White House Commission that took place about 20 years ago under between the Clinton and the Bush administration transition, that we actually had a chiropractor on the commission. And there was a focus on the role of integrative healthcare in our society. And I actually moved from the National Institutes of Health to working with the U.S. Congress. And that was the reason I was hired, was to focus specifically on the role of complementary and integrative health in our healthcare system. And as I have, 3 decades later, and lots of science exposure and lots of congressional hearings and lots of other factors in life, chiropractic is a separate and distinct healthcare profession with its own science, art, and philosophy. For me, it's the first stop. If I have something going on in my life, and I like to get regular chiropractic adjustments on a weekly basis, if at all possible, because it's like if you're a mechanic, you're fine tuning your car all the time to keep it at its prime. But as a human being, well, as a spiritual being having a human experience, which is how I like to look at it, getting an adjustment helps keep our information flow from the brain to the rest of the body in tune. And, for somebody who works in a high stress environment like I have in the political world and in Congress, and now for the ICA as the Executive Director, there is a need to make sure that I'm my optimal self. And I'm an imperfect person. I have a lot of things that I could do better in my life, but getting an adjustment is the first step, and having that good chiropractic interaction. And the fact that you're going to a healthcare professional whose first option isn't to offer you a chemical interaction to put something else in your body. It's more focused on, let's align the spine, let's address the joints, and remove any interferences so that the body's own ability through the innate to focus on being its optimal best is to me the solution. The body wasn't designed to have a chemical interaction to be well. There are times when drugs are necessary. When I worked for Congress, I would tell people, if you have a 3-alarm fire, then yes, open that fire hydrant and put some water on it. But if you just need a drink of water, don't open the fire hydrant. And most of what we have in society and in our own lives doesn't require the fire hydrant. It requires that drink of water. And so chiropractic is like that. It's about addressing the issues on an individual basis, specific to what my needs are or your needs are or anybody else's. And when you have healthcare statistics that say 85% of diseases on the planet are lifestyle related, we don't put 85% of the research dollars into addressing that. We put 85% into drug development. So the model of healthcare research is even wrong. And how are we finding solutions? So when you see your chiropractor, are they telling you need to drink more water, plant-based, 80% plant-focused diet potentially, or going for walks and de-stressing? All those are the science has shown actually can do things like reverse heart disease. And chiropractic plays a role there. And one of my passions is the science. And so this week at our convention, we actually have some of the best scientists in chiropractic presenting at our continuing education program. Deed Harrison, Stephanie Sullivan, Curtis Fedorchuk. I mean, we have some amazing scientists presenting. And from somebody who spent 7 years at the NIH, if you have science directly is tied to policy and regulations. So we need more science. And from my perspective, we need to be investing more in high quality research, not just literature reviews, but in actually doing clinically based chiropractic research. The whole person effect of chiropractic for me is a goal, to have a large practice-based research network with academic ties of looking at the whole person effect of regular chiropractic care across the lifespan. As I believe, from what I have read in the preliminary studies that exist, that we will see everything from cardiovascular benefit to immune function benefit to the whole gastric system issue. 75% of the immune system is in the gastric system. So because there's nothing in the body isn't connected to the rest of the body. So when you have that communication flow that's working at its optimal best, then the body has the chance to be its best self.
Well, you nailed it right there. You talked about the science, philosophy, and art of chiropractic. And I really believe that the people that listen to our show, they need to hear that message more frequently. And they need to hear that message, as open and honest as you can describe it. And I do think that one of the things I talk a lot about on our show is cradle to grave care, womb to tomb. And I tell people also that, I've never recommended the chiropractic lifestyle to somebody that their quality of life diminished. I only see people that do chiropractic services and follow the chiropractic lifestyle to have better quality of life. And they don't have to go to the doctor for the pills, potions, and lotions and shots. They actually have better quality of life with somebody that's going to tell them how to regulate what they do for their day-to-day activities. Somebody that can tell them what to regulate for how they feed and, for lack of better terms, feed and water themselves. Like you have to take care of your body through the basic premise of existence. And then I also believe, like my good friend Eric Plasker, he's going to be at your convention.
Absolutely.
And he always tells me chiropractic first, chiropractic second, chiropractic third, chiropractic fourth, chiropractic fifth, chiropractic in this sixth, chiropractic in that seventh, chiropractic in that eighth. But don't stop chiropractic with these other interventions. He's like, always include chiropractic along that journey back to health.
And he's exactly right. And I'm glad you brought up Dr. Plasker, because he has, he's amazing. And he coined the term 100-year lifestyle. And the whole premise is, if you know you're going to live to 100, how do you live your life? And, I don't know how long I'll live. I hope I live to 100. But if I live to 100, I want it to be with a high quality life. I don't want to be, institutionalized and unable to function and on, 24 meds and all of these other things that so many people whose life, the average woman who's 65 years of age is on 10 medications at one time, at any given time.
Wow.
And part of that is the system, because now in Medicare, medications are reimbursed, so that they're covered under Medicare now. So now, of course, if it's paid for, the doctor's going to prescribe more, because that's what they do. The tool in their toolbox is a prescription pad, instead of their own hands, to be able to make that adjustment and to help the body, focus on its own optimal self. And so the medical model has made people into dependent on medications. And I'm not saying you should never take any medication. That's a personal, everybody's needs are different and unique, and people's philosophical choices of how they seek health are their own to make that choice. I mean, I have relatives that if there's a pill for it, they want it. And I'm like, I'd rather go to an adjustment. If there's a vitamin for it, I'd rather do that instead. I'd rather look for a more natural solution, but it's also a philosophy that's different mine than someone else. And that's what's so important in the whole picture of healthcare, is that we have to know what rings true for ourselves. And I've spent my entire life exploring what is truth. And that comes from a spiritual basis. It comes from a governmental basis and a regulatory basis. And the work that I did in Congress, you alluded to it a little bit. I was hired to focus on complementary and integrative healthcare, but then I was shifted into why do we have an autism epidemic? And we were the first ones to talk about an autism epidemic in the year 2000. And now here we are 21 years later, and instead of 1 in 2,000 children, we have 1 in 36 children in the United States on the autism spectrum.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is sponsored by Transact Card, Align Life, Neuro Infinity, Imaging Services, Chiro Health USA, Chiro Moguls, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, New Patients in a Box, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. Let's hustle.
And, and that is what happened. We don't have a genetic epidemic, but we have children who have been exposed to something that has changed their body's makeup and their neurological response to issues. And so we have chiropractors across the country and the pediatric realm who are taking care of these children. We have some specific clinics across the country who specialize in taking care of children who are neurodiverse, who are dealing with things like not being able to speak, not potty training, not being able to focus, having tics or other issues or seizure disorders. And those are all things that families living with autism live with. And I got to know many thousands of these families, and we all have a moral responsibility to be a part of the solution. And that's how, when I finished my work with Congress, I actually stayed involved, very deeply involved in doing things like Freedom of Information Act requests and studying the issues that we had done in Congress, looking at the issue, which you brought up, the issue of vaccines and health freedom. There was a lot of evidence that supported what the parents were saying. Sadly, there was also some corruption in the process of investigating those issues at the court level with the vaccine compensation program, all of which I'm happy to see that Children's Health Defense and Barbara Loe Fisher's organization, National Vaccine Information Center, the two expert organizations that really have taken that on and taken the lead in addressing and informing people, doing the hard work, the litigation that's coming through Children's Health Defense. And I just heard that Mississippi is going to be required to have a religious freedom exemption restored, which is a huge victory in the courts. The fact that any state would take away somebody's religious liberty is unconstitutional. And I'm glad to see that the right fight was fought in the courts and is at this point a victory.
Yeah. You hit me like in a deep spot. And I think that it's been really rare for me to actually cry on any episode I've ever done. But it just hit me so hard because I feel that it is a family's choice as to how they take a product, whether it's knowing what's in their drinking water or knowing what's in the ingredients to some food, and we put a lot of scrutiny on that because kids have allergies. And if there's a kid that's going to allergy and there's a peanut thing going into anything, we want to know, is there peanuts in this? Because there's kids that have allergies to this in this class. So we want to know more about what's in our food than what we do take from an injection or a pill.
You've hit the nail on the head here in talking about this issue, because it all comes back down to the fundamentals of life. In public health, the most important thing, the most important accomplishment that ever happened in public health is not the development of vaccines. It is the development of a clean water supply and the sewage system, basically, in urban environments in particular. Those two things, clean water is the basis of having a quality public health. And it has, of course, across history been the solution to issues dealing with epidemics of cholera or other things. It always comes down, you have outbreaks of cholera, for instance, in Haiti. It is because they don't have the proper drainage system and the infrastructure developed. And in the 21st century, in a country that's not very far from the United States, we have an island that has yet to be able to build the infrastructure, even though we We in other countries have invested a lot of donations in charitable works. We have not been able to resolve these issues, and we need to. Those are the things we should be putting our money into, is not putting chemicals in the environment, but helping people to develop their infrastructure. And then focusing on healthy and clean foods, whole foods, rather than foods that have been so processed you don't know what's in them. Former Governor Huckabee, years ago, he said, if you can't pronounce the words on the ingredient list and you don't know what they are, you probably shouldn't be eating it.
Yeah.
That was a very smart thing that he just lost 100 pounds at the time. He said, this is what I did. If I read the ingredient list and I couldn't pronounce them, then I didn't eat that food. And by following that lifestyle at that point in his life, he lost 100 pounds over about a year and a half. So.
Well, I think, you speak a lot of truth there. And if people actually knew what they were like feeding their families, they'd have a lot more scrutiny for it. And
and you talked about the water supply, and it's interesting. Clinton Ray Miller was what I call the father of health freedom in this country. He was from Utah. He got very upset about the fluoride in the water system, and he actually became very politically engaged and fought the health freedom battle for 50 years. He lived to the ripe old age of, I think, 92, and he was a dear friend. He was a mentor. And he said, he fought this battle and he got pushback, but now science has caught up, and we are beginning as a society, because the science is catching up, to agree with him that should we be putting fluoride into a water system to swallow fluoride when, if you're at your dentist office, you spit it out? Or should you have a toothpaste that has fluoride in it? There's a balance there that the science needs to be done correctly, and it needs to speak. And instead of people who have an invested interest or a vested interest making money on seeing a policy take place, or having a water system have fluoride in it or products in it. For 40 years, I've never looked at the ingredient list on my toothpaste until recently, because I listened to a podcast that talked about toothpaste, and completely changed into a product that doesn't have some of the chemicals in it that I didn't realize were in toothpaste and the standard brands of toothpaste. So little things like that we can do, being an informed consumer, is important for being in control of our own lives. And that's where we are in 2023 in this country. We've gone through a period where our freedom to speak in a public forum on social media was curtailed. You as a broadcaster, having being worried to mention the V word because you're worried that it'll affect your capacity to share your message. We should not have fear in the communications infrastructure of this country. And social media, Facebook, Twitter, all of these other forums, we are now finding out they have become tools of those who want to monitor what we're saying, as opposed and to control that environment and control the messaging. When I type in something on Facebook and it sends me to a government website for information, there's something wrong in our world, because this is the United States of America. I'm not in Cuba. I'm not in a communist country. I'm in a country that's based on freedoms. And so I shouldn't have a government forcing me to a page that I didn't seek out. And I'm glad to see what Elon Musk is doing, and, letting people know what's behind the curtain. It's like the Wizard of Oz, where you pull back the curtain and who's running the machine. He's doing a lot of that this year. And I think that's very important to where we are as our society, because the public, each of us, is really tired of people trying to take away our freedoms. And this correlates exactly into the message of what happened in chiropractic, where the 1950s and the early 1960s, chiropractic was growing. People were becoming aware, and all of the state licensings were taking place. And the American Medical Association pushed back. They created a committee on quackery, and then they marketed to their doctors that you should not even socialize at the same country club as a chiropractor, much less refer a patient or receive a patient from a chiropractor. So there was an organized effort to restrain the trade of chiropractic, and there was a desire to destroy the profession. And thank goodness they were not successful. However, we're still dealing with the vestiges of that discrimination. For instance, in Medicare, the language that was put in 1972 was in the middle of the federal case, Wilk versus the AMA. And there was discriminatory language put into the law, which ICA has a bill that will be reintroduced very soon to remove those discriminations against Medicare beneficiaries who seek chiropractic care. So the whole point of not being able to opt out if you want to have private contracting with your chiropractor, or not being able to be reimbursed for the routine exam or the imaging, the X-ray imaging, as that are both required to have a quality, to determine the adjustment. It's a good standard, or it's a standard of care, but right now there's a discrimination, not just against the chiropractor, but the Medicare beneficiary who's having to pay out of pocket into a system they've already paid into for decades. So we're working on having that reintroduced, and we very much want to see this passed into law, and we hope that all the Chiro Hustle listeners will get on board and help us get co-sponsors and to see it become law.
Well, there's so much that goes into supporting this profession of chiropractic, and I think that we all have a position on that team. I love teamwork. And I love the fact that you do have great leadership within the ICA, and you have people that are helping perpetuate some of these missions and get the message out there about how to support the ICA. And I think that there's a lot going on. I could probably talk to you for another 2 hours on topics involved with medical freedom, family health freedom. But I am curious. I usually ask this question to people that are on the show, and it's almost self-serving for me, but I'm going to close the gap down a little bit. Okay. I always ask, like 20 years from now, where do you see the profession of chiropractic going? But I want to shorten the lead a little bit for you. Let's talk 5 years. Where's chiropractic going with you being the executive director of the ICA in the next 5 years?
Well, if I'm able to achieve my vision of where chiropractic is in 5 years, if we can get the profession to work together and not to keep, as they say, circling the wagons and shooting inward, which seems to happen a lot in chiropractic, if we can get past the tribalism and, you're a mixer, so I can't talk to you, or you're super straight and you're a straight hater or whatever, all these terms, if we can focus on promoting chiropractic as a separate and distinct profession that has the capacity to work miracles in lives, which happens every day in offices around the world. I see chiropractic becoming a predominant healthcare profession around the world, where every human being on the planet has the opportunity to choose to be a chiropractor, if that's their life path, and to have access to chiropractic care, because we have been able to grow the profession so that there are chiropractors in all 200 countries around the world. That's my vision, is that chiropractic needs to be everywhere. I read the Big Idea frequently, because between the Sacred Trust and the Big Idea, that's the solution. If we can, as a profession, if the chiropractic profession can work together to work out any challenges of communication and being comfortable with each other, and focus on being chiropractors. You don't need to be a jack of all trades and do everything in your office to be a chiropractor. You need to be providing the adjustment, to have the access to do your imaging. If you want to specialize in upper cervical or pediatrics or sports and fitness, those are all amazing and wonderful. And ICA has councils that lead the profession in those trainings and specialized in their diplomate programs. But it's about being the best chiropractor that you can be, so that every day some child walks through your door with their parents and you're having a conversation with them and you're talking to them about getting an adjustment so that your body has its ability to stay well. And you're talking about with that parent who's dealing with a lot of stress or a couple of jobs, or taking care of their ailing parent, and you're providing that, not just the adjustment and the environment, but you're also providing an environment of hope. and talking about learning. We talk about the 33 principles in chiropractic and ICA a lot, and we share that message. And I have to say, Dr. Selena Sigafus-Jackson teaches the 33 principles. She lives the 33 principles, and I have learned so much working with her as the president of the ICA, because she is the example of what it is to live a chiropractic lifestyle. And this is what Dr. Plasker talks about. It's what people like Deed Harrison are researching, the effect on the human body when you get regular chiropractic care, and studying it in a scientific realm gives us the answers that you see in chiropractic offices every day. When you have somebody who's had migraine headaches for 30 years and have had to take drug after drug after drug that doesn't fix anything, and they go and get a series of adjustments, maybe one, maybe 2 or 3, and those migraines don't come back, that is a miracle in somebody's life. When you look at somebody who's a mentor and a friend, Dr. Jerry Klum, who was losing his vision as a young man and who went through the medical route, and his whole story is amazing, and became the president of Life West University, worked at Life, became to Life West, and living today with some health challenges of his own, but he's a gentleman and a scholar of chiropractic, and one of the wisest, kindest people I would ever meet. And his story is a miracle. I mean, it's the same thing. Chiropractic became a profession not because you fix somebody's back and neck pain, because it restored somebody's hearing. These are miracles that happen all the time. And I've had that happen in my own life with having, taking a roller skating and taking a dive and having a headache and not realizing. One time I didn't go to the chiropractor first and go to the medical doctor, and they throw you in a hospital and do all these x-rays and stuff. And, didn't bother to go below the skull, didn't look at the neck, went to the chiropractor after checking out of the hospital, and he did it. We haven't done x-rays on you in a while. Did the x-ray, saw the misalignment, fixed it, headaches are gone. So those are the things that happen in everybody's life. I hear them. Dr. Selena talks about them on our videos that she does on a weekly basis, some of the experiences in her office, sharing things, and other people share it on your show, I'm sure, as well. Mm-hmm. But it's just really important that we protect and promote the profession, that we work, and ICA works in advocacy in Washington and around in the states. That's why we have state representatives in the assembly, to stay engaged and help where we can. And we also, because we are an international organization, we have members in over 50 countries in the world and plan on growing more. So in 5 years, if we can focus on the positives of chiropractic and the things we have in common as organizations and as people interested, we can be so much further in delivering chiropractic, not just 1 million a day adjustments a day, but 10 million adjustments a day. We can make sure that chiropractic is in every VA facility or referred to in a system that's working for veterans in their local environments, to chiropractors in the local community, and that and we have a member of Congress who wants to have a chiropractor on every Navy vessel that's deployed, so that everybody, and then across the military, to have chiropractic for all of our military. These are things that are goals of the ICA to see happen, goals of mine to see implemented, but also we need to make sure that the system where chiropractors are compensated is both fair and efficient. And right now, they're neither. So those are all the big things that we have to accomplish. But we have to work. ICA can't do it alone. We are very engaged with, for instance, the strategic planning, Chiro Future Strategic Plan. We're very engaged there. We work with the Integrative Health. We're major partners in the Integrative Health Policy Consortium. So we work across the professions of the Integrative Health community. And we're very active in Washington. I'm on Capitol Hill frequently. I have lots of colleagues and friends, and we have others involved in the office that are also very involved in Washington. And our chiropractors are very much, one of our board members, one of our officers just testified at a state legislature hearing on issues. So that's how, we all work together on these important issues.
Beth Clay, I love you so much. I'm so thankful for you to be our guest today. I'm so thankful for your passion and your consistency. You stay so tight on brand with this beautiful profession. I once again, I'm just really thankful that we're in network now. We can work better together. I do think that we have a lot of alignment, pun intended, when it comes to protecting this profession moving forward. I look forward to doing great things with the ICA. I do want to ask you, if people wanted to support the ICA, how do they do that, and how do we connect them with you?
So the chiropractic.org is our website. And so you can go there. We also have Facebook pages and Twitter. And, you can reach out, and we're even on LinkedIn. So, you can engage through the social media. We also have a 501c3 foundation. People wanted to make donations. That this is for research and scholarships in chiropractic. And that's the foundation. It's called FACS is the acronym, the Foundation for the Advancement of Chiropractic Tenets and Science. And if anybody wants to make a donation to the FACS, you can call the office, or you can go online and promote and make donations. And, there's, anything that anybody can do to support chiropractic and support the ICA and its mission, which is, we are focused on protecting and promoting the profession and keeping it. When Dr. George Curry brought me on board I initially started as a consultant with the organization, he said, we have two hard lines in the sand: no surgery and no drugs. And so those are the hard lines in the sand, because chiropractors don't need to be surgeons. You're not trained to be. And you don't need to be prescribing drugs, because there's enough people out there that are doing that already. And if somebody needs medicine, send them to somebody that's what their training is, because chiropractors training is focused on, or it should be focused on, providing the best diagnostic through imaging and the tools that have been developed specific to chiropractic, and then delivering the adjustment. And I can tell you, every time I get an adjustment and they move those bones in my spine, take that deep breath, it is mind-blowing to me how different the body is after an adjustment, and then 90 minutes later, and then the next day, and going on and on. And, you guys, literally, the future of healthcare is in the hands of chiropractic, and we need to be focused on making that what becomes a high priority across all systems of health policy and every country. I am blessed to have lived in the Middle East. I lived in Saudi Arabia for 3 years. I want to see, universities, chiropractic colleges across Saudi Arabia and China and Russia and all across the Middle East and Africa and South America. I want to see every country have multiple schools, so that everyone has a capacity to become a doctor of chiropractic and do what our doctors at the ICA do on a daily basis.
Beth Clay, you're episode 514 of the Chiro Hustle podcast. You guys should go out and support this group, the ICA. I believe everybody in chiropractic should be a member. Everybody should be giving their time, their talent, and their treasure. Give all three to the ICA. Support their missions and visions. And let's make a better future for chiropractic. Beth, just want you to have an awesome rest of your day out there in Las Vegas. I'll see you there on Thursday. I'll be there throughout the weekend with you. And just thank you for organizing and bringing so many great people together to move this beautiful profession forward.
Right. And it's not too late to register. Anybody that wants to go online and register at chiropractic.org, there's a link right on the front page. And you can join us right here in beautiful Las Vegas.
All right, Beth. Well, I'm going to close out by telling everyone you're just one story away. Keep hustling. I'll see you guys on the next episode. Beth, thank you so much for your time today.
Thank you.
All right. Talk to you soon. Bye for now.
Bye-bye.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.